Nice to be back after a little
This meeting is being recorded.
Couple month break. So I am happy to be back, and our session today is going to be a little bit different than what we have done in the past, in that there's more of an educational component today, but we're still going to be doing some exercise towards the end as well. And for the exercises today, we're going to talk about making sure that we have adequate intensity. So if you have bands at home, or if you have weights, hand weights, like about a pound or 2 pounds, you feel free to get those because those would be helpful when we're doing the exercises today. And for the first part, I am going to actually try to share a PowerPoint presentation. So let me pull that up for everybody. Let's see, it gives me just a second to get the slideshow going. Okay, let's see. Sorry that we do these Zoom sessions a lot, but we don't always share PowerPoint. So give me just a second. Okay, can everybody see that? Jonas, can you tell me if everybody can you see the PowerPoint?
I don't think so. Could you try sharing it again?
Let me try sharing that again. What about now?
Yep, you just got to pull it. I can see you're sharing your screen. You just got to go back to the PowerPoint along the bottom there.
Okay. All right, let me see if I can pull up the PowerPoint. What about now? Is
yep,
the PowerPoint?
And if you put it in the slideshow, that should work.
All right, good.
Perfect.
Is that weird?
You're good.
Oh, that's always a relief when the technology works. All right, so I'm talking today about sarcopenia and effective strengthening for the geriatric population. So we're basically talking anybody over the age of 65. Now, sarcopenia, let me go to the next slide. It's a Latin word that basically means poverty of flesh, and that sounds really dire. But what we use it for in the medical community is a term to indicate age-related loss of muscle mass. And this term was first introduced in the late 80s. And it's something that happens to everybody. We all lose muscle mass as we age. There's nothing we can do about the fact that it is going to happen. There is something that we can do about the amount that it happens and the impact that it has on us. So that's kind of the focus of the talk today. And if anybody has ever heard this term, or the doctor has given you this definition, then really two things are happening. They have seen that you have lost muscle mass, and they can see that on different X-ray techniques. But you also have to have loss of function. So they can tell that you're just not as strong as they feel you should be. When those two things happen together, then the doctor may give you a diagnosis of sarcopenia. If people are still functioning pretty good and getting around and able to do everything for themselves, you may have low muscle mass, but they wouldn't necessarily give you a diagnosis of sarcopenia. So how is this measured? Like I said, the mass is measured with different X-ray techniques. They can also do MRIs, or they can do CT scans. That'll actually show the amount of mass that the muscle is taking up space. And then strength, usually patients are referred to physical therapy. Sometimes doctors do this in their office. Squeezing a dynamometer with your hands to determine grip strength is a common way that they're testing strength. And then we in therapy do a test that's called a 5-time Sitsa stand or a 30-second Sitsa stand, where we're basically having people stand up, sit down, 5 times in a row, and we time how fast that takes, or we count how many times people can do that in 30 seconds. And there's some normative data that will indicate whether or not you're within normal limits for strength or if you're below or above. And then we also look at how people are functioning. And so we would look at how fast can you walk. The tug, the next one on the slide there at the bottom, that's a timed up and go, which is a test where we ask people to get up, walk 10 feet, turn around, come back to the chair and sit back down. And that the cutoff for that would be 13.5 seconds. And then the other two are more subjective batteries where we're asking, like, can you climb a flight of stairs? Can you take a shower by yourself? Those type of things would indicate if people are having trouble with their function. And then again, to have a diagnosis of sarcopenia, you'd have to have both the x-rays or the MRIs, the scans show a loss of muscle mass and the function or the strength being declined. Now, what causes that? I mentioned that everybody gets this. So sarcopenia is up on the top, and this is not the best slide. I apologize for that. Some things like being on steroids, having abnormal thyroid, being a diabetic, that can influence it. Anybody who has neurological diseases like polyneuropathy, or certainly more serious neurological diseases like MS or stroke, those would speed up sarcopenia. The lower right corner of the slide, cachexia, has to do with cancer. But I really want this topic to focus on the lower left corner, the disuse, which is what happens to a lot of people as we age. We become less mobile, our joints maybe hurt a little bit more, and we just gradually start doing less. Or if we've had an illness and we've been in the hospital, and we've been in bed for a period of time while we're recovering, that's significant disuse, and that can really speed up that age-related muscle mass loss. And then the circle in the middle on the bottom, it has to do with nutrition. And that's where I'm going to focus the first half of this talk. So before we get to that, just a couple more facts. Loss of muscle mass actually starts in our 30s, believe it or not, where everything goes downhill starting in the 30s. And we lose an average of about 10% of our muscle mass per decade. Now, it's less in your 30s, more in your 80s and 90s, but an average of about 10% per decade. Men are affected more than women. The larger muscles in the legs, like your thigh muscles, your buttock muscles, are affected more than the ones in your arm. We have different fibers in our muscles. The ones that are there for power, the type 2 fibers, are more affected than the endurance fibers. And everyone is affected. There's nobody that this isn't something that's happening to them. And then this is the slippery slope of aging. So if you look on the y-axis, vigor has to do with strength. How much power can your muscles generate? And then the x-axis is age. And you see how if you're young and you have a lot of strength, you're in the fun box. You're able to do all kinds of things, like you might go skiing or run a marathon or play soccer. You're doing pretty much anything you want. And then as the strength comes down, which usually coincides with the age going up, we may not be having as much fun. I mean, we have different fun. I should define that. But we're able to function. We're able to do our everyday activities. We're able to go to the store. We're able to climb a flight of stairs in our house. And then as that goes on, you see how now we're down to frailty. And that's where we as therapists, and when I do community outreach, we want to try to prevent people from going into that box. And we definitely don't want people to end up in failure. So if through this talk, if I can, get people who are close to frailty to move up into function, and the people who are close, the upper end of function, to be able to have, a few more things that they would like to do for fun, then that is mission accomplished. All right, so as far as treatment, I'm not sure why I put medication at the top of the slide. I should have put it at the bottom, because there is no medication. There is not a magic pill that we can take to prevent this from happening. But the two things that we can do to influence this is diet and exercise. So we're going to talk about that today. And the main focus of the diet when it comes to sarcopenia has to do with making sure that we get enough protein. We want to make sure that we get protein in every meal. And the recommendations for protein intake for geriatrics are actually higher than the regular RDA guidelines. And I'll go into that a little bit more. And then we also are going to talk about appropriate exercise. So for protein needs for the older adults, the older adult needs 1.0 to 1.2 grams of protein per kilogram body weight. So make sure you're not doing this calculation based on your pound weight, but you'd have to convert that to kilograms. So, let's say, you weigh about, I can't do this math in my head, but, about 50 to 60 kilograms would be a typical adult weight. So you're looking at, 50 to 60, even a little bit more grams of protein per day. If you have any underlying health conditions, especially chronic kidney disease, or if you're on dialysis, you really want to talk to your nutritionist or your physician about increasing your protein intake. I am not a nutritionist, a dietitian. So if you have other underlying diseases, you really do need to make sure that you're not going overboard with your protein. So what are some good sources of protein? All our meats, so whether it's beef, chicken, ham, pork, our fish, those are excellent sources of protein. Dairy products, milk, yogurt, cottage cheese, even ice cream. Sometimes when we get people that have been in the hospital a long time and their appetite is really poor, just to give them that little boost, we may say, go ahead and have a milkshake with ice cream, and then maybe even adding some supplement like Ensure or Boost. I think most people are familiar with those drinks. Those are a nice extra protein source. And then don't forget about nuts, almonds, and beans and lentils, chickpeas. Those are all good sources of protein too. And spinach is actually on this list, which I didn't know, but now I'm going to add that in my recommendation to patients. And you can certainly, if you Google like grams of protein and add like your particular food, it's easy to find on the internet kind of exactly how much protein is in a meal. So when I get frail people in the clinic for therapy, or people that have been in the hospital, they're really deconditioned, they're weak. Sometimes people say, okay, I'm out of the hospital, I'm going to be super healthy, and I'm just going to eat fruits and vegetables, which we would then point out that really, as we're trying to build strength, your body is looking for those building blocks. It's looking for protein. So we encourage people to make sure that they have adequate protein with every meal. And this just is another slide to kind of see the difference between, regular adult guidelines are 0.8 grams per kilogram. 65 and older, it's a little bit higher. But you do want to be cautious with too much. Do not go out to Whole Foods and buy a whole bunch of high protein bars and eat, too many of those in a day. It can be too much of a good thing. So you don't want to go overboard because that can, again, add to dehydration, problems with kidney disease. This is another thing that I wasn't aware of until I delved into this a little bit more, is that you do want to spread the protein out throughout the day. So if you say, okay, I had eggs and steak and yogurt, I had a super high protein breakfast, but then I'm only eating fruits and vegetables the rest of the day. It would be better to spread that out throughout the day because the body can only absorb so much protein at a time. So it's better to just 3 meals and make sure each meal has a serving of protein. And I like in this slide, I get so many patients in here that have coffee and toast for breakfast. And again, that there's really no protein in that, or coffee and a pastry. So try to add something like a cup of yogurt, some cottage cheese, even regular cheese on toast, or peanut butter to increase the protein in that particular meal. And I won't go into a whole lot about like the supplements like Boost or Ensure. Sometimes patients find those really hard to drink an entire can in one serving. So kind of sipping those throughout the day, if you really are in need of a little extra protein, might be a good alternative for that. Okay, so that's all I'm going to say about nutrition. And again, nutrition is all focused about protein for this particular issue, right? There's all kinds of other nutritional needs for other issues, but when we're talking about building muscle mass, then we're talking specifically about protein. And so now I'm going to talk about exercise a little bit more, which is the other tool we have to slow down losing muscle mass as we age. And I promise I will leave time at the end for questions. So this gentleman is a former well-known lawyer who, very famous. He had a bunch of well-known cases, and he is on the talk circuit now about exercise as a way to prevent age-related muscle mass. And he has a lot of stuff out on YouTube. I think in this particular photo, I think he's 88 years old in this picture. So he's my new idol, but his workouts are really hard, really intense. I'm not recommending that, but he is a good example of if you stay active and exercise, you definitely can slow down this age-related muscle mass loss. Okay, so let me get out of that. I'm going to stop sharing my screen now. Okay, am I back? Everybody can see me now? Okay, good. So let me go ahead and move on into the exercise piece. And then again, please, if you have any questions about the nutrition part, I will leave time at the end. So when we've done the fall prevention classes, I've always just focused on leg exercises. Today, we're going to actually do some arm and leg exercises because this sarcopenia can impact the arms as well. The legs are more affected, but it can impact your arms as well. And so, for the ability to pick up bags of groceries, a box out of a closet, we want to maintain our arm strength as well. And the key to exercising and making sure that the muscles get stronger or stay strong is to make sure that you're doing the exercise at the right intensity. And this is something that even therapists like me, who've been doing this for more than 30 years, we kind of had to have a little education ourselves, because sometimes we got in a rut of putting people through exercises and they were too easy. And the way that when you exercise, the way that you can tell, okay, am I working hard enough, is when you do your exercise, and we're going to stick kind of with 3 sets of 10. It should be, if you were to rate it in terms of difficulty on a scale of 0 to 10, 0 would be so easy, I could do it all day long. 10 would be, wow, hardest thing I could imagine doing. You need to be at least at a 5 or higher. So it should, like at the end of your 3 sets of 10, it should feel like, whoa, this was hard. So ask yourself when you're exercising, was this easy, medium, or hard? If it's easy, it's nice, but it won't make you stronger, and it won't prevent age-related muscle mass loss. So again, it should be at least medium to hard. It should not be so hard that you can't do the 3 sets of 10. You know, I go to the gym myself and I see people, and they're trying to lift crazy heavy weights like 3 times. That puts us at risk for injury. So we should stick with about 30 repetitions, whether that's 3 sets of 10, 2 sets of 10, 2 sets of 15. But it should feel, definitely by that 3rd set, it should feel pretty hard. Okay, so let's start with some arm ones. And let me see here. Whoops. Sorry, I just lost my screen. Am I still there on your screen?
Yes, we still see you.
Okay, good. Okay, hold on. I'm just trying to get myself back. Okay, well, good. You guys can still see and hear me, right? Yes, you can still.
You're good. You're good.
Okay, good. Sorry. All right, so we're going to start with, we'll start with some curls. Now for curls, you can either use weights, like I have 2-pound weights, or 3 pounds. I wouldn't go too heavy on these. If you have items around the house, like soup cans or water bottles, bags of rice. So we're going to go ahead and do our 3 sets of 10 nice and slow. 2, 3, 4, 5, 6, 7, 8, 9, 10, and again, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I'm already, like, I'm using 2-pound weights. I'm starting to feel like, okay, this is getting harder. 3, 4, 5, 6, 7, 8, 9, and 10. And if I were to rate that myself, I probably would have given that about a 4. So I could have added a little bit more weight to do that. Now for the triceps, you can either use your weight and bring your arm up this way, or if you don't have weights and want to use a band, you can certainly do that with a band, or you can even go out to the side with the band. So I'm going to do this one out to the side. 2, 3, 4, 5, 6, 7, 8, 9. Good. And then I'm going to go to the other side. 2, 3, 4, 5, 6, 8. Good. And just for variation, I'm going to go up and down this time. 4, 5, 6, 8. And I'm going to do my other arm as well. And then we're going to do one more set, and I'm going to go back to doing this in front. 3, 4. So I'm bending the elbow, straightening it back out. 6, 7. And then on the other side. And 10. And if you're using bands and you're wondering what color should I use, the lighter colors have less resistance, the darker colors have more resistance. So I'm using a blue that's towards the heavier end of the resistance. And I was asking myself when I was doing that, is this easy, medium, or hard? And that was definitely a little bit ahead of medium. I would give myself about a 6 doing that. So I got my tricep workout done for today. Don't need to do that one later. And strength training doesn't have to be every day. I gave this similar talk to my colleagues a couple of years ago, where I really looked into the research as far as how frequently do we need to do it. Even people that were doing it once or twice a week were showing functional gains. So most commonly the things out there are about 3 to 4 times a week. But like I said, even people that were just doing these once or twice a week still made progress. Let's do 2 more arm ones. So the next one is just putting the arms in front and then pulling the band apart. Now notice I'm keeping my arms straight. This is more working my upper back. 6, 7, 8, 9, 10. And you could use weights with these. It works the muscles slightly different, but you're still getting a strengthening benefit doing these with weights. 6, 7, 8, 9, 10. And again, there's lots of things in your home that you can use as weights. Don't go too heavy on the arm weights. I don't want anybody to end up tearing a rotator cuff because they have too much weight. One more set of 10. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now, and if you're getting pain with these, like, oh boy, my shoulder really bothers me when I'm trying to do some of these arm exercises, and you really want to be able to do a good strengthening workout, that might be something to discuss with your physician. Say, okay, the pain in my joints is keeping me from doing this. And then a short course of physical therapy could probably help, or we could either customize the exercises to you or find out what the underlying issue is with the joint pain, and see if we can reduce that. So if you're like, I can't do these because everything just hurts, don't just write it off. I'm sure there are ways that we could modify things for you, where you could still do exercises, but again, we would need to see you in the clinic for that. And then I have one more shoulder one I'd like to do before we move on to legs. And again, hopefully people can see me. So I'm going to use my band, and I'm going to step on the middle. So now it's anchored to the floor, and I'm just raising my arms forward. Now, I probably shouldn't be doing this with a blue band, because that's a little bit, I'd like people to try to raise their arms to shoulder height, which the length of the band that I have has too much tension. So I'm not going to strain my shoulder. 8, 9, 10, good. So I'm going to do it with weights for these other 2 sets. And I'm raising just to shoulder height. 3, 4, 5, 6, 8, 9, 10. And if you have one shoulder that's bad, you can certainly do it with the other arm. 2, 3, 4, 5, 6, 7, 8, 9. Good. So I just want to make a quick note about shoulder exercises to shoulder height. If you wanted to do an exercise like a triceps, having your arm here with your elbow bent, that's okay. We just don't ever recommend with weight to go from being down here all the way up. Because if you're doing that with weight, you really put strain on the rotator cuff, and that could certainly, lead to some problems. So we wouldn't want you to do that. So this is okay, but not with weight going up like this. Good. And I was able to get my screen to come back, so now I'm not doing this blind anymore. Okay, hope everybody's doing okay. I do want to do some leg exercises, and these should not be unfamiliar because we've done a lot of these in the other classes. And let's start with my favorite, which is that sit to stand. And again, we're working the big muscles in the legs, so we're just standing up and then slowly sitting down. Try to do that without using your hands, but if you have to use your hands, you can. 3 and 4, 5, 6, 7, 8, 9, and 10. Okay. Now this one, if you wanted to make that harder, you could again take your band, step on it, have some tension on it, and then as you're standing, you're fighting the tension of your band. So that's a little harder. You could vary the height of the chair as long as your knees could tolerate that. The lower the surface, the harder the exercise. So I definitely feel the difference in the second set. And another way to work these same muscles, if you wanted to mix it up a little bit, would be to do a wall slide where you put your back against the wall and then do a little slide up and down that way. You know, and our knees, even my knees are a little creaky when I do these. So I'm going to limit how low I go. I'm going to go nice and slow. And you know, it works our thighs and our buttocks, which those are our biggest muscles. And remember I said the bigger muscles, the leg muscles, are the ones that are most affected by sarcopenia. And those are also the muscles that functionally we use the most. Like anytime we get up, especially from a low surface like a toilet or the sofa, those are the muscles that get us up. Those are the muscles that get us upstairs, you know, for walking, for balance. So I always have my little pitch on the Sitsa stands, or wall slides could be a nice alternative. Good. I see some questions popping up. I'll make sure at the end that we get through all of them, but keep those questions coming. So let's do our hip abduction next. And again, this is one that should be familiar from the other classes. I'm going to do mine with a green band today. And I tied it into a loop that's about shoulder width apart. And I'm going to put the loop around my ankles. And let me make sure people can see me. And I'm actually going to put one hand on the wall to give me a little bit of help. And then I'm going to swing my leg out to the side. So you can use the back of your chair or table. Eight, 9, 10. And certainly, you know, some people may just want to do these without a band, that it's hard enough for them without a band. Or if you have ankle weights, like cuff weights, I would say a 2 to 3 pound cuff weight is a good amount for this one. Okay, and I'm going to switch again to my other leg. And I'm asking myself, how hard is this? Is this easy, medium, or hard? And I'm definitely getting towards medium. Good, and then one more time on the other leg. And if you have one color band and you're starting to notice that this is getting kind of easy, see if you can tighten the band or double it up. And if you're already as tight as it can go and it's still pretty easy and you wanted to challenge yourself, slow them down. You see how I just kind of, almost like I'm in slow motion. Because the slower you do it, I can really feel that, the more that works that muscle. And 10. Okay. Just for time's sake, I'm not going to do the other one, but the other variation would be to bring the leg to the back. We have done that one in the other classes, and you can see how you can use the band the same way. Let's actually, let's go ahead and do the heel raises next. And you can do both feet at the same time. We've done this one in the class before, but I bet a lot of people say, okay, if I did 30 of these, I could do that all day. It's not at a high enough intensity. So I'm going to do this one leg at a time. So we're working the calf muscles here, which is another nice big muscle. Good, and then I'm going to do my other leg. Excellent. And then go ahead, if you're standing and you're feeling like, okay, I could do another set of those, go ahead and do that. I just wanted to show a variation. If some people, because of foot pain, if they're like, I can't do that on my toes because it's hurting my toes too much. If you have a band, you could loop the band around your forefoot, and then you're just pushing down on the band as if you're pressing on the gas pedal. So that's another great way, and you probably need a darker color band for this to make sure that you're working the muscle hard enough. Good, so that's another option, and I'll do some on the other foot. And 10. Okay. I'm going to just do one set of 10 of this last one because I want to leave enough time for questions. So this is another one that's, I'm going to show you two different ways. If you have a loop, you could use the same loop. You could do this seated, just bringing your knees apart and back in. This works some muscles on the side that stabilize our hips. We give this to a lot of our patients with back pain as well, because if we get the hips more stable, usually the back feels better. So you could do that seating, or if you wanted to a more advanced way, you could stand with your knees a little bit bent, so in a little bit of a squat position, and you could step sideways. You don't want to be totally straight. You want to have your knees a little bit bent, and then a nice big step to one side, and a nice big step. You will definitely feel that in those muscles. Even doing this one without a band is not a bad idea. And then you could go up in color, go longer one direction before you shift it to the other direction. And I think this would be a pretty easy one to reach that intensity level of greater than a 5. So I'm glad that we were able to delve into this a little bit more in detail than I had been able to do with the other exercise classes, because I think just driving the point home of making sure we're doing things at a level that's high enough to reap the benefit is really important if you're going to go through the time of doing the exercises. So we have just about 10 minutes, and I am opening up these questions here. All right, let's see. How many days a week should we do the upper body exercises? As somebody asked that. Again, once or twice a week is going to give you benefits. Most of the research is 3 to 4 times a week. It does not need to be something that's every day. Do regular squats away from the wall have the same effect as the Sitsa stand? Yes, the answer is yes. So if that's an exercise that you've been doing, your knees can tolerate that, that's perfectly fine. You do want to, if you're doing a squat, even with the Sitsa stand, just because I don't want any of you guys to become my patient who's coming in for knee pain, when we stand up or squat, we want to make sure that our knees stay lined up over our feet. We don't want to see this. Right? That's an example of what not to do, to bring the knees in. And we see that a lot, especially in women. So you want to try, okay, let me just make sure that my knees stay in line over my toes, whether you're doing a squat or a Sitsa stand or a wall slide. All right, then somebody asked, at what age is bone density test on older adults no longer beneficial? I don't know the answer to that. That would be something to ask the doctor. But I'm glad that you brought up bone density, and that, maybe we can even delve into that more for a future topic. Exercise as a way to decrease osteoporosis and maintain bone density. Today we're all talking about muscle mass, but certainly we know that exercise also helps reduce loss of bone. So that I'll look into what's out there, and that might be a good topic for a future lecture. Let's see. Does a good long walk do the same thing for leg muscles as exercise? So I'm glad you asked that question, because I get a lot of patients who say, Fika, I'm a walker. I walk all the time. Why do I need to do strengthening exercise? And the answer is if you regularly walk, your muscles are going to get to a certain point of strength where they can walk. they will not get stronger from doing that. It's a nice, there's lots of benefits for walking. I'm not going to say don't walk. Certainly for bone health, cardiac health, there's lots of benefits. But if you're looking to keep those muscles from getting weaker from that age-related stuff, you got to work them to where they're feeling that challenge a little bit more. Let's see. Is it safe to do these with diseases like progressive Parkinson's? Absolutely. Absolutely. I mean, we see a lot of people with Parkinson's or other progressive diseases here, and we would love to work with people who have those diagnoses. There are other exercises that are really beneficial, but any kind of strengthening is good for people with other progressive diseases. So yeah, you can absolutely do those. There's no harm in doing that. So those were all the pop-up questions. Did anyone want to unmute? Does anyone have any other questions for me?
Yes, I have a question. There was an article in the February-March issue of AARP magazine on nutrition, and it said that older people need 25 to 30 grams of protein at each meal of the day. I find that very hard to do. What was the number that you recommended?
So 25 to 30 grams, that sounds high to me, because that would bring you like 75 to 90 grams of protein. That's high, unless you were like a big man. It's about a gram of protein per kilogram of weight. And I'm sorry, I should have done like a little conversion chart, but I think if you weigh about 150, I don't know, maybe Jonas could quickly do the math. About how many, I think most people like 60 kilograms, 50 to 60 kilograms, I think is more typical adult weight. So you would have to do that math, but that number sounds high to me that you're given. Okay, a kilogram is 2.2 pounds. Thank you, Kathy. So that way you could do that conversion to see what your weight is. I'm going to do that real quick to see. Yeah, so 150 pounds would be 68 kilograms. So that number, the 75 to 90, that sounds awfully high. And again, knowing that too much can be a problem.
No, I said 50 to 75 was what they're recommending. So you're saying 68. 68 is the women.
I thought you said 25 to 30 grams per meal.
Per meal. Oh, you're right. You're right. I did.
So if you ate 3 meals, I mean, maybe they're assuming you're only eating 2 meals.
But 68 grams, because I think it was 25 was more for women and 30 for men. So yeah, that's about the same, really.
Yeah, I mean, again, when I looked at like a piece of chicken or a piece of fish, that's like usually around 25 grams a serving of. So if you're eating some of that.
Dr. Janson, a dilemma with that Parkinson's is that the medication Sinemet prohibits, much protein, or you have to distance it such that, I mean, I'm down now to 2 meals because of that. I have to space it so much.
Well, you're absolutely right. I mean, you're absolutely right that you can't have protein compete with the Sinemet. Right. Which adds a whole other challenge, because you gotta space your medications to be effective, and then you gotta kind of think about your meals. So you're right, that does add a whole other challenge to that, and definitely something to discuss with the doctor, or even to get help from a nutritionist. Like, how do I How do I make this work with that?
I learned that at the clinic with you, but you probably don't remember that because I had to stop because of the the exercises we were doing were too difficult for me. But they were exactly what I need. It's a dilemma.
You're right. Anybody have another question? I think I have time for one more. Well, I hope this was helpful just to kind of get people thinking about the importance of protein as we age.
Hello, can you hear me? Hello. Oh, wait, can you hear me? I did have a question. I was talking.
Go ahead.
Okay.
Go ahead.
Okay. Yes, I'm having a problem with OA, osteoarthritis, and I was so the right heart is really hard to get up. Out of the bed, in the tub, anywhere. If I'm sitting down, it's just hard to get up. Feel heavy, like I'm out of balance. It's really difficult. And my doctor said perhaps maybe wearing a twist tie around my waist, but that didn't work. And I use a cane to walk around. The exercise seemed to help, lifting my legs up and down. That sometimes bothers me.
So I would really recommend, if you're having specific functional challenges, like being able to do, everyday activities, because it's hard to lift your arm, you're needing a cane with your balance. Ask your doctor if you can have an order for occupational or physical therapy. Occupational therapy could probably delve into your shoulder and your arm issues a little bit more, and then we could find out specifically for you what would be the best exercises, what would be the best way to go forward. But yeah, if you're having some specific difficulties like that, ask the doctor if they would consider a therapy referral.
Yeah, I had surgery on my right hip too, the joint, and the wrap. So those were what he gave me, and so I didn't know what to do.
Good. Well, I'm glad you're coming to the class here. So wrapping it up, I do hope that people kind of just think about protein in their diet as part of the importance of maintaining strength and getting the full benefit from exercise. And thinking about, am I working hard enough when I do my exercises? Am I challenging myself enough to make sure that I'm getting the maximum benefit? So I hope that was helpful. I always enjoy these, and I'll look into some good topics for the next one.
Thank you very much. That was a very informative topic, and thank you for taking the time.
Thank you. I appreciate it.
Wonderful. Nice to see everybody.
Thank you.
Are we gonna get copies?
Bye-bye.